my name's David, and I wanted to talk to you about some shoulder issues people have been having. So I'm going to start off by describing a little bit of how the shoulder works. So when I was little, my first anatomy lesson in shoulders was the superhero dolls I grew up with, where the torso is basically a plastic tube, and their arm bone kind of just stuck into the side and moved like this. There's a little ball there, so the arm can move in those directions, which served to inform my young mind. However, now that we practice yoga, there's other things we want to do with our arms besides this. Basically, the arm bone also has this thing called a shoulder blade, and the shoulder blade moves around your rib cage. So it's not just a hole in the side of your rib cage that your arm attaches to. There's this movement of the whole of your arm bone with the shoulder blade as it moves around. So this might all be obvious to you, but where people get stuck with it is in things like triangle pose, where the top arm tries to stay in place. Maybe, hopefully you can see there's a back bend here, and I'm straining the front of my shoulder. So the trick here is to bring your hand forward so that your arm bone is in line with your shoulder blade, and then move your whole shoulder blade back, and then your arm bone will move more freely. Most people will then go to here, back bend it again. But what we want to do is back it off, squeeze back, open, back off, squeeze the shoulder blade back, and open. And that's how you prevent shoulder pain in triangle pose.
Do you suffer from intervertebral hernia? You have tried different methods of treatment, but the pain is still in your back. You have been offered surgery, but you prefer to avoid it. Then, this video is for you. Additional and manual treatment of disc hernia don't give stable results, just kill pain for some time. Surgical extraction of disc hernia, even made with an easy invasive method, doesn't eliminate the cause of sickness and can lead to disablement. Luckily for us, there is a person, Dr. Danilov, who can help us, who has learned all methods of manual therapy existing in the world, who made hundreds of operations on the spine and column, and 1,000 laboratory researches. The result of Dr. Danilov's exploration is the unique method of non-surgical treatment of hernia devised by him and patented in Ukraine, Russia and Switzerland. This is a vertebral revitological method. Today, Dr. Danilov is a professor, academic and author of the book Osteochondrosis for a Professional Patient. His method works successfully and has already helped many patients who had almost no hope. The method of Dr. Danilov has nothing in common with known chiropractic or osteopathy. With his procedures, Dr. Danilov changes biological mechanics of the spinal column, decreasing inner pressure on the damaged disc, producing special conditions for the disc regeneration. Although it was considered before that the degeneration had no reverse process. Here are some results of treatment according to Dr. Danilov's method. As they say, no comments.